versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another storage, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging,
I don't know what to do. I don't know.
most intimate, and most rewarding
Happy birthday!
In hospital, wonderful.
moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is The Secret Life of the Hospital Bed. Falls account for 40% of all ambulance call-outs for older people. In Newcastle, some of the most serious casualties come here, to the Royal Victoria Infirmary.
Hiya, it's Sally. We've just had a pre-alert for an 11-year-old male.
Like most A&E departments, the RVI has a special area for patients with life-threatening illnesses or injuries. It's called Resus.
Hello there. Hello.
These Resus beds meet patients at a critical point, often when their lives hang in the balance. This is Resus Bed 2, waiting for its next patient. 64-year-old painter and decorator Howard has fallen from a ladder, hitting his head on a kitchen unit.
They've done the bloods.
Fine.
I've got some morphine and bits and bobs prescribed
Great.
for him, so just if you could...
So I'll do a thorough exam.
Yeah, is that
and
okay?
I'll let you know.
Good man, thank you very much.
Registrar Dr. Voorgees has been working in A&E for 11 years.
Any pain in the tummy?
I'm only pain, but I'm sitting up.
Something full.
It's full,
Any pain where I press here?
Talking about antibiotics.
Okay. Is it okay if I just lay you back down?
Howard?
And where does that hurt? Where does...
Bottom
On the back, sorry for that.
Howard has had several brain aneurysms. These are bulges in his blood vessel walls, which can burst.
So do you remember the whole thing?
I was painting above a kitchen unit. I was on a pair of steps.
Mm-hmm.
And I was like leaned over. I came up the steps.
You slipped.
I can't remember, I was banging. Banged my head and fallen to the floor.
When did you lose consciousness? Was it immediately after the fall or later?
When I slipped and fell up, I banged my head and hit the floor then. So basically from banging my head, I hit the floor. That was it.
When did you lose consciousness? Was it immediately after the fall or later?
As he's hit his head, Howard is at high risk of having a bleed on the brain.
When I slipped.
His only daughter Jen rushed him to hospital.
Does it feel big? Oh, yeah. Yeah, it's quite big. It's your head you're worried about, really, isn't it?
Yeah. I had 4 major strokes. Aneurysm.
3 aneurysms, I should say.
Epilepsy.
Yeah.
Some people can have a seizure in the first few weeks after a stroke. And a small number, like Howard, go on to develop epilepsy.
When he had his first fit, it was horrible. None of us had any experience of seeing a fit, so we didn't know it was a fit. So we just thought, what on earth is happening to him? He was thrashing about and pouring the blood out his mouth because he bit his tongue. Once he had them more, it was just a case of just make sure you didn't hurt yourself, make sure you didn't fall.
So who found you?
Student nurse Belle gets Howard ready for his brain scan.
He's obviously banged his head today, so I'm a little bit worried about it, but we're going to get a scan out.
Well, I worked in this hospital, painting this hospital for 3 years.
Oh, did you? That's lovely. How long ago?
When it was built.
Yeah?
When the new bit was done, wasn't it?
New build.
3 years ago.
No, more than that.
I'll put this on this one.
This is called an ultrasound machine. It's like a video scan. It's just to have a quick look in your tummy, just to see if there is anything wrong.
No.
What previous tummy surgeries have you had? Have you had any tummy surgeries?
I had cancer.
Had a cancer for
Bowel cancer.
bowel cancer.
The operation to remove cancer from Howard's bowel 3 years ago was successful.
So why I'm doing the scan there is to see if there's any blood in the tummy.
Last year, he also broke 3 ribs after a fall at work.
I think when he broke his ribs, that was the thing that bothered him the most, was that he was so immobile, he couldn't do anything. And like for his age, he's 64 and all he's had wrong with him is so active. Like he looks after my kids every weekend, 4-year-old and 1-year-old, they run him ragged.
The ultrasound shows no bleeding in his stomach. Resusbed 2 takes Howard to his CT scan. The next hour is critical. The results will reveal if Howard's fall has led to a potentially fatal bleed on his brain. Queen's Hospital in Romford has one of the largest maternity units in the country. The beds here see over 9,000 births a year. Each one can take as little as 2 hours or more than 3 days.
More of his face.
Maternity bed 7 is with 29-year-old Hayley. She's determined to give birth naturally after having an emergency caesarean with her first child.
Is she coming out? She'll come. She will. She has to. She's coming out. She will be. Trust me on that. Yeah, she is. She's not coming out right at this moment, but she will. Okay.
Midwife Marn is with Hayley, who's been in labour for an hour.
Hayley has had one baby before. That baby was delivered by caesarean section 10 years ago. So today she is aiming to have vaginal delivery. So that's her plan.
I never wanted a cesarean last time. I had no choice. But then I was kind of glad because he was £10.4, so pushing that out, I'd imagine, would be a bit of a
lot worse than what you are now.
She's really positive and focused for this today. She seems to have a really good attitude. Yeah.
She's been given the painkiller pethidine and is using gas and air to get her through.
I feel like Picasso painting. I feel like my mouth's going.
It's not, I promise.
Drink.
I will tell you if your mouth starts to do that. She's coping marvellously. Her breathing technique is fabulous with the Entonox gas and air. So she's got herself into her own little zone now. Yeah. Smile again. Yeah.
She's full of laughter despite, she's in pain. She's got this theory about, laughter is the best medicine, which is definitely working for her.
It's like I stick to swearing.
Hayley and her partner Aaron have been together for 18 months.
Well, I've got a child from previous relationship, and so has she. We've got a boy and a girl, so this is our first one together, yeah.
Because Hayley's first child was a caesarean, she faces extra risks with a natural birth.
There's always a risk of scar rupture.
Not doing well.
You are.
You're observing for signs of scar rupture all the time, and Mum's aware of that as well. She will tell us if she starts to feel any tenderness or pain or anything like that.
Contraction.
Okay, breathe.
With the contractions, so sometimes it's hard to tell if it's the scar or if not. Obviously, always you will escalate. You will let your senior colleague know and have someone come to review her and the situation.
Please get her out, please.
I know you're feeling that pressure. Baby's head is very low, okay?
I can't do this.
You can. You are. You're halfway there. You're more than halfway there.
I really can't do this. It's gone.
You feel like there's a very strong pressure.
If Hayley's caesarean scar ruptures, her baby's life could be in danger.
Is this my scar?
Bear with me, all right?
Maternity bed 7 is on standby to take Hayley to theatre if she needs an emergency caesarean.
I can't cope anymore, and I really can't.
I promise you you're coping.
The Great North Children's Hospital in Newcastle is the only dedicated paediatric centre in the UK to have been rated as outstanding by the Care Quality Commission.
Hello, it's A&E.
Their paediatric A&E department has 9 beds. Seeing almost 500 patients a week, these beds are permanently on call to deal with emergencies. From split heads, to allergies, to broken bones. Paediatric bed 27 is prepped and ready for its next patient. Working alongside the beds today, a nurse practitioner Ainsley
They can just go across to the pod, can't they?
and nurse Carmichael.
It's a very scary environment for a child to come in, and if you want them to be compliant and also be happy and not as scared, the best way is to try and make them as comfortable as possible.
It's just before lunchtime. Bed 27 is about to meet 2-year-old Mason and his mum Jessica.
Wow, where's that toy?
Mason was admitted to hospital recently with facial cellulitis. There are signs it's come back.
Mason, can I have a little look at your face, sweetheart? What? Yeah.
Cellulitis is a potentially dangerous infection of the deeper layers of the skin.
Right, I've just got a little pen, so I'm just going to draw some little pointers to where it is at the minute. Mason, sweetheart, do you think you can sit still? I'm going to draw on your face. Way back here.
Staff nurse Carmichael draws a line around the affected area.
I don't think it really goes past your nose there, does it?
Symptoms of cellulitis include red, hot and swollen skin. If the redness crosses the line, it's a sign the infection is spreading.
And obviously, if you notice it getting any bigger, all right, just let us know, but we'll keep checking on him, obviously. And that's just these actions.
Cellulitis can spread quickly and, if untreated, can be life-threatening. If Mason's cellulitis is severe, he'll be given antibiotics intravenously.
Right, Mason, sweetheart, can I put some magic cream on your hands and then you can keep playing, can't you? Oh. Ooh.
This cream will numb Mason's hand in preparation.
I'll put this big sticker on your hand. Oh no, it's not sore, is it? Does it look a bit funny? It hurts. It's just a bit cold, sweetheart. I'll pop this round, we'll hide it. Shall we? We'll hide it.
Approximately 30% of all patients who are treated for facial cellulitis see the infection return.
The first time he had it, he had like quite a build-up where his eye was all red, and then last night he was fine. There was no build-up, and it was just happened when he woke up, where his face, like the right side of his face, swelled up, and he couldn't open his eye in the morning.
There we go. That's it. Well done. Stickers.
Bye-bye.
Good boy.
Nurse practitioner Ainsley comes to examine Mason.
Hello. Yeah. What's been happening?
Last night he was totally fine, nothing wrong, and then he just woke up.
Woke up like this.
Like,
this morning.
yeah, exactly like this.
Hey, little mister, can I come and have a little look at your face? Can we have a little look? Should we have a little look underneath that lovely bottle of milk of yours? Can you lift your head up for me?
I'll do that.
Oh, well done. What a good boy. Right, I'm going to have a little feel of your neck while you're like that. Oh, that was a good one. I'll go and speak to the paediatric team.
Right, okay.
I mean, obviously it is quite swollen and red at the moment.
Mhm.
I'll ask to come and have a little look. Depending on the blood results, they may think that he's okay just to start on oral antibiotics, and hopefully we've caught it early enough.
Right.
Untreated cellulitis can also lead to blood poisoning.
We'll let you finish your milk in peace. And as I say, Mum, I'll go and speak to the team and then I'll come back and let you know what's happening, okay?
Oh, it all.
See you soon! I'll get a wave!
Goodbye.
Half a wave! Cool.
Thank you.
It can be quite severe, so it can spread. It could spread to the eye area, it could spread into the lymph glands, and it can particularly become quite serious quite quickly. Mason will get a blood test which will determine the severity of the infection that he's got at the present, and we will determine from there whether he needs oral antibiotics or the intravenous antibiotics.
Hi, Mason.
Hi, Mason. We're back.
Sister Jackson arrives to help take Mason's blood.
Oh, it's a sad face now.
We're going to take them off. Should we take your boxing gloves off? Shall we?
The anaesthetic cream on his hands should stop the needles causing any pain.
Will you just kind of give him a little bit of support, Mum, and then we'll get this done as quick as we can.
That's funny. You can read the book if you want me, Mummy.
Look at Mummy. Look at Mummy. I know, look at Mummy.
The bloods were very stressful. At that age range, they can be quite squirmy. Obviously, they're scared. They don't know what's happening. So sometimes it can be a little bit tricky. Ideally, sometimes them cuddled into Mum helps a great deal. But in this situation, he actually sat quite still on the bed. So that was a good bonus for us.
Look at Mummy, baby.
Look at these teddy bears. Well done. Just going to rest.
Oh, don't do that
Can
one.
we move you a little bit? There you go.
Come here.
Mason and Mum Jessica will have to wait to find out how severe the infection is. And if he'll have to be admitted for intravenous antibiotics. In Newcastle's Royal Victoria Infirmary, it's been a busy shift on the A&E ward. One of their most critical patients, Howard, arrived on resusbed 2 half an hour ago after falling from a ladder. Emergency department consultant Dr. Voorgees is taking him for a CT scan to check for internal bleeding in the brain and abdomen.
He's getting scanned almost everything. So that contains a head, chest and abdomen. He hit his head on the way down and also on the low back. He does have a large swelling on the back part of his head. So the definite concerns are any bleed to the brain or inside the skull. Have you got the biggest monitor? Yeah.
So we're concerned about back of the head.
Back of the head.
Thoracolumbar junction,
Right
right
flank.
flank.
Yeah, and the thoracolumbar area.
Howard has been in hospital before with brain aneurysms.
His previous history, so when you have an aneurysm, so that's the blood vessel is weak, that can increase the chance of having second bleed in the brain.
Resusbed 2 takes Howard back to his bay. Howard has previously survived cancer and several strokes.
Has he had any heart problems? No.
About the only thing he hasn't had.
Any kidney problems?
He's been unlucky, but he's been lucky as well, because that if he hadn't have had the fits, they wouldn't have found the aneurysms in his head. And if he hadn't have had the strokes, which resulted in him having the cholesterol test, they wouldn't have found his blood count was low, which found the cancer. And the doctor said to him, if you hadn't have found the cancer when they did, it would have been too late, wouldn't have been able to treat it.
This is my most worrying bit.
Hitting his head.
My head.
Whenever he hits his head, that's the big worry, with him having the aneurysms. Got two that were big enough to put a coil in, which is like to stop them bursting, I suppose. But then one of them was too small to fit a coil in, so one of them's just free, sitting there.
I just want to put it on the bed.
Dr. Voorhees is back with an update.
We have scanned your chest, tummy and pelvis and the head. They will officially report it in probably 1 hour time. In the meantime, I would probably want to do some x-rays because it's quite sore in here, isn't it?
Yeah, that's what I banged it.
Alright, fine. Need to get some x-rays of that hand, okay?
Howard will stay with Resus Bed 2 until the trauma team carries out further vital tests. Birmingham has the youngest population in Europe, with under 25s making up 40% of its residents. Caring for the city's young and old is the Queen Elizabeth Hospital.
Can I borrow your bed slightly?
The day surgery unit has more than 80 beds. They are with patients during some of the most vulnerable moments in their life.
Right, you get mentally prepared for this.
Day surgery bed 41 is waiting for its next patient.
Hello Rose, it's Sue Ward, how are you? I'm just checking up on people that you need to sleep so that I don't double count.
19-year-old Bradley is having a third operation to repair a fracture. He broke a bone in his wrist 2 years ago after a fall.
I was playing football, I just landed on my wrist funny.
Bradley broke his scaphoid bone, the smallest in the wrist. It's a fracture that can prove hard to heal.
It was a lot of visits here to get my wrist sorted. My mum says that I have might as well have a loyalty card for the hospitals. I've been here so much, and now this is hopefully the last case scenario where they take the bone out completely and put a plate over, which should just get rid of the pain.
Here we are.
Cheers, thank you.
No problem whatsoever.
Surgeon Mr. Tan will carry out the procedure today.
You're right.
Repairing such a small bone will involve lengthy surgery.
Is it under regional or general?
We thought about actually putting you to sleep.
Okay.
The operation can take up to 2 hours.
Right.
When you're getting towards 2 hours, if you're awake, it starts to get a bit uncomfortable.
Right.
So that's probably the default, is to put you to sleep. We'll give you the block as well, so that you've got post-op pain relief.
Okay. I'll tell you what the beauties of being left-handed.
You're going to take that fairly soon.
Okay, cool. All right, thanks.
Bradley calls his mum to let her know that he won't be discharged tonight.
You're right. So they're keeping me overnight because the pain is going to be a lot more than it was when I last had my other op. And you know how I just was able to just go home. They're not going to let that happen this time because of the distance I've got to go. I'll ring you once I've woken up. All right. See you later. Mum's the only one that I rely on. Don't have a dad that's around, so she's kind of done everything for me. I was just letting her know that I've got to stay overnight so she hasn't got to travel up tonight.
Day surgery bed 41 takes Bradley to theatre.
Just want it over and done with. I'm nervous. I hate operations. I've never been good with needles or operations. You'd think that you get used to it after probably, 3 or 4 times, but it never gets any easier. I'm having the general, so I'll be asleep for the operation and hopefully I'll just wake up when it's all done.
Anaesthetist Dr. Barrios is aiming for Bradley to wake up pain-free.
Okay, what I'm about to inject might make your arm feel a little bit cold and achy. So if it gets uncomfortable, just let me know and I'll slow down, all right? We're going to target the nerves that supply the arm, and we're going to target them at the armpit.
He's using an ultrasound machine to give him greater accuracy as he administers a nerve block.
And the next targets are up here at the top of the screen. So you can see my block needle there. You're blocking the conduction of painful stimuli from the hand and the wrist to the brain. And that's the block done. We're going to proceed to theatre and go ahead with the operation. So the block needs a good 20 minutes to establish fully.
Bradley will stay on bed 41 until the surgery begins. Back in Newcastle, at the Great North Children's Hospital, bed 27 is empty.
Shall I sit down?
2-year-old Mason prefers the comfort of Mum Jessica's knee. She's concerned he's had a relapse of facial cellulitis, a potentially life-threatening condition.
Do you think he could have facial cellulitis? Or?
Yeah, quite possibly, yeah. I mean, that's probably what it is. It's just a case of ensuring that, you know, it's safe enough just to have the oral antibiotics rather than going down the route of the IV antibiotics like before.
Without antibiotics, cellulitis can lead to serious complications, such as septicemia or kidney damage.
Don't look at it.
Mason may need to be admitted overnight for observations.
We have informed our coordinator to whether he might need admission, so that bed needs to be booked quite quickly. It can always be cancelled in the future if he does go home on the antibiotics, but generally we do book the beds sooner rather than later.
Dr. Modno has come to assess Mason.
Sorry, I was just going to say you could go for a wander. I think he's getting a bit bored in here. Can the doctor come and see you first and then you can go for your walk?
Not yet, not
She's
yet.
like, now,
Oh, sorry.
out of here.
Sorry.
2 minutes.
Mason's been with paediatric bed 27 in A&E for just over 2 hours. Earlier, a line was drawn around the perimeter of the cellulitis to monitor if the infection is spreading.
No, but is it contagious or not?
Usually cellulitis is not infectious unless it's something else. There are no signs that he has the bug elsewhere or in his mouth. It looks like it's sort of around the face. So quite likely it's just in his face. But it's on the other side this time, isn't it? And his left side of the face is actually starting to become red as well. Is that something new? Is that?
That was all today.
That was all today.
Like everything that you're saying now is all just started. Thank you.
Dr. Modno's examination confirms Mason's infection is getting worse.
Hey, Hayden.
No.
I'm still see it.
Unfortunately, it's started to spread a bit more. He's got a little bit more redness and his left eye is now starting to become a bit more puffy. He is otherwise still quite well in himself, but the doctors are concerned regarding the swelling, so he's going to be admitted. His blood results will come back okay, but there's still the concern of the spreading cellulitis. Right, Mum, should we take him down the bottom there?
Mason and Mum Jessica head to the assessment unit for further monitoring. Paediatric bed 27 is cleaned up, ready for the next patient. Next door, in the A&E department of Newcastle's Royal Victoria Infirmary, Rhesus bed 2 is with 64-year-old decorator Howard. He's fallen off a ladder at work and banged his head on a work surface. Doctors are concerned he may have a bleed on the brain and multiple broken bones.
I think you get more than that.
Did national insurance for what? 40 year, 50 year.
I think you get more than your money's worth.
No, not really, sorry.
He's already had a CT scan to check if he has brain damage.
Hi mate, just going through for some x-rays, alright? Just in that room behind me.
Ta-da.
Hi.
Bring this round, buddy. Just pop this in behind your back, alright? Can you lean forward a little bit for me? That's the one.
Due to Howard's serious injuries, the X-ray of his chest and back are carried out on Resus Bed 2.
I think this will be the last one where the doctor's going to have a look and see what they think, you know. Even do that much and just get up and do it again.
Daughter Jen is with Howard.
Everything he's had wrong with him, he's never ever been down about it, he's never been bitter. I've seen him cry once when the first thing happened, when he had his strokes, because he was apologising, saying sorry that he felt like he'd let her down, and obviously he said that he hadn't. But since then he's just been so strong.
An hour after being admitted, the results are back from Howard's CT scan.
Looks okay, isn't it?
Yeah, it looks all right actually. Can't
Yeah.
see any acute phases,
Yeah.
some incidental findings.
No problem, thank you.
Thank you.
He's just been in, you know what I mean, done the full scans and that. He has said that everything was all right. So like with the breakages, so it looks as though it's going to be all right.
Again?
Dr. Voorgees has news.
So, it looks like there's a fracture on the back. You have got a rib fracture on the left side. So that's the reason you're getting admitted to the hospital for pain management.
So he's got, what, a fracture on the back?
On the back. And
this
then he
side?
has got fracture on the ribs as well. Okay?
So he's just been admitted
For pain
his
management.
elbow, okay.
Yeah.
So how long will he be in for, do you know?
Maybe 2 or 3 days. Okay?
That's fine, thank you very much.
Thank you.
With a broken vertebrae and ribs, Howard faces a longer stay in hospital to recover.
It's a shame, you know, but you as well stay in and get looked after properly.
We'll just wrap some bubble wrap around you.
No,
Be fine.
Resus Bed 2 will stay with him until a bed on the ward becomes available.
Short t-shirt.
So, t-shirt.
Socks.
Huh?
Put your slippers.
At Queen's Hospital in Romford, maternity bed 7 is with 29-year-old Hayley. She's been in labour for 5 hours.
There's still no baby.
Midwife Marn was concerned Hayley's caesarean scar from her first birth was tearing.
Oh, it's got to be almost done now.
She's now in the final stages of labour and the danger has subsided.
If only it was that easy. Come on. I have been where you are. Never would I call this easy. She's not letting go of anything.
Rearrange the hand.
If you break his hand, he's not going to be able to change the nappies.
Can I have the caesarean?
Remember that. Baby's head is just sitting there next.
Oh, please get out of me, Anne.
She's coming.
I can't.
You can.
Please.
It's alright.
Doing well.
She's only got one way out now.
I know. When they're coming up ready to deliver, a lot of women will feel that they can't do it. Whereas they thought before, oh, I'm coping quite well, all of a sudden now she's feeling like I'm not able to do it. And it's classically for someone to say, oh, please just pull the baby out, take it away.
The baby's head is just sitting there. You can tell her now, Aaron. And again, come on, push. Don't trip.
Midwife Yasmin is also helping to deliver Hayley's baby.
Now you're doing this nice deep breaths. You're going to blow baby out. We're working together now. Yeah?
Baby.
Hello, cutie pie. Welcome to the world.
Hayley and Aaron's daughter is born naturally, just as they wanted.
She is gorgeous. Look at you.
They've already chosen a name. Ella Louise.
Well done, Hayley.
The average baby girl weighs around 7 pounds 4 ounces. Ella Louise is a healthy 9 pound and 5 ounces.
Oh, that's
They
so
continue
cute.
for a little while. Oh, she's beauty. Is that a hand-knitted hat?
I think your sister done this one,
Yeah,
didn't
she
she?
looks it's gorgeous.
What a pretty little thing. Oh, hello. It was you, was it? Yeah. She's like, oh, that annoying voice. Put me back. And let's let you sit up a little bit, actually.
It's nearly an hour since Ella Louise was born,
Is it painful?
but she's now suffering serious complications.
I know.
Is it stinging or is it your tummy? Are you feeling it contract?
Hayley still hasn't delivered her placenta.
Let's give it one more go, sweetheart.
If any part of the placenta remains in the womb, there's a risk of hemorrhaging.
Just keep taking the gas. Hayley, see if you can just give us a push.
Bailey, yeah? Push down like you did with baby. Keep push down, yeah? Come on, you can do it.
And you can't feel it at all?
If it's not delivered soon, the placenta will have to be removed by a surgeon under general anaesthetic.
Placenta. Because if it doesn't come, we might have to intervene, as in the doctors might need to try and remove it, but you would need to go to theatre to have that done.
Oh.
I know. See if you can give me a push, Hayley.
I am trying.
I know you're trying. I know you. See if you can give me one big push. Okay, all right.
We've waited an hour for the placenta to come, but because it's not advancing now, we're going to take her into theatres and we're going to try manual removal of placenta.
Hi Gladys, it's Nadia from Labour Ward.
Just to be on the safer side, we don't want to keep it any longer.
Dad Aaron and baby Ella Louise stay together as bed 7 takes Hayley to theatre for surgery.
Ready, steady, slide.
Birmingham's Queen Elizabeth Hospital. 19-year-old Bradley has been separated from day surgery bed 41. He's being operated on by Mr. Tan.
So what this operation is now doing is the scaphoid obviously hasn't healed and it's sort of degenerated in time. So we've taken out the whole of that bone.
Bradley's having a plate and screws inserted into his wrist to replace a broken bone in his hand. After 3 hours in surgery, Bradley comes round, back on day surgery bed 41. The first thing he does is call his mum.
I'm alive. I came around about 4:45. Apparently everything went well. I've had water. I've literally drank like a litre of water already, but I need a massive wee and I've got to pee in a bowl. I'm in a half cast at the moment. Alright, I'll see you later. Alright, bye-bye. 2 brothers and a sister. I'm the oldest out of all of them. Mum's had to single-handedly look after all 4 of us for the last 9 or 10 years. So, yeah, stressful.
Bradley will be in plaster for 6 to 8 weeks while he recovers. He's transferred to another ward where his pain levels will be monitored and treated overnight. The shift comes to an end for day surgery bed 41. It's prepped and ready for its next patient tomorrow. In Romford, at the Queen's Hospital, bed 7 and midwife Yasmin are taking 29-year-old Hayley into theatre. She's given birth to a healthy baby girl, but she's now suffering serious complications.
In a lot of pain.
Sorry.
That's all right, darling. That's fine. You're trying, at least.
Normally, a placenta is delivered within 60 minutes, But 2 hours after giving birth, Hayley's placenta is still attached.
Okay, right.
It needs to be surgically removed. If it's not, Hayley could hemorrhage.
There's risk of increased bleeding, she could have a hemorrhage, also can lead to infection and things like that.
Right. You feel comfortable at all? There is one more pillow. There is one more pillow. How about that?
Hayley, I'm just going to quickly go get your baby and put your baby in this. I can do the baby checks when we're sorting you out, okay? I'll be back very shortly.
Line.
Baby Ella Louise is brought to theatre to be close to her mum, leaving father Aaron alone. Hayley is in severe pain and opts to be put under general anaesthetic. Just as the procedure is about to start, nature intervenes.
With all the movement and trying to get all the general anaesthetic sorted, by the time we actually got it all sorted, the placenta literally just delivered. Yeah, which also happens sometimes as well.
Maternity bed 7 takes Hayley back to be reunited with her family.
Her observations are completely stable now. It's just for the general anaesthesia to start wearing off a little bit and she'll feel fine.
24 hours later, and Hayley's son Jamie and Aaron's daughter Macy are meeting their new sister.
Very sweet.
Tired, but good. It was definitely surreal and probably not one that I would repeat again. Yeah, just can't wait to go home now. You don't want no more, do you? No.
But if another one does come, then, and it's a boy, then the odds will be even.
There will be, but
No more.
there's no more coming. We won't fit in the car.
Our hospital beds have given us intimate access to the work of the NHS. Howard was kept in hospital for a week with his broken ribs and vertebrae. He's already back painting and decorating. Young Mason had 24 hours of intravenous antibiotics. The swelling on his face has now cleared. 4 weeks on, and Bradley's hand is healing. He should soon be able to use it pain-free. And baby Ella Louise is now home with parents Hayley and Aaron. The beds are now back on their wards, ready and waiting for their next round of patients.